Thanks so much, I'm here to cause you indigestion today. The observant ones amongst you will have noticed that I'm speaking at the wrong moment on the program, and that's because I was late. And the reason why I was late is that I was trapped in a room with 25 sex workers who wouldn't let me out this morning. Half of that statement is true. I won't tell you which half. I first met Afaf Malays several years ago when she was working on a commission that we were taking part in on health professional education. There's a global health worker crisis. We have over 4 billion health workers, too short of what we need. And Afaf, on that commission, as she continues to do, represented an extraordinary voice and vision, not only for women, but also for interprofessional education. I was so taken with Afaf, I fell in love with her instantly as we were doing that commission, that I wanted to go and see what her program was in Pennsylvania, in Philadelphia. And if you go and visit the program that she and her colleagues have created at the University of Pennsylvania, I promise you, you will be stunned and astonished at the incredible success and innovation of what she and her team have created at the School of Nursing. It is an unusual place. Originally, I trained as a doctor. And there is a natural hierarchy in the health professional world, and the natural hierarchy that all doctors are taught is that they sit at the top, not at the University of Pennsylvania. Very impressively, what Afaf has created there is equity between the professions, a peaceful and productive coexistence that improves the health of those in Philadelphia served by the University of Pennsylvania. She is first amongst equals with her colleagues at that university. And when you see that equity in practice, you realize it's what we are lacking in the United Kingdom and what we desperately need. So much did she inspire me that we've now set up a Lancet Commission on Nursing, with the explicit goal of thinking about how we can create in the United Kingdom what Afaf and her colleagues have created in the United States. We have some way to go, but we have a model to follow. Now, when Afaf asked us to join her in this conference, my immediate answer was, yes, of course. Why? First, because of the focus on women. We've already heard mention of the Millennium Development Goals, and the past 15 years have been a remarkable period in human history for placing MDG 4, a child survival goal, and MDG 5, a maternal and reproductive health goal, on the global political map. But we still too often think, when we think of women's health, as women only as mothers, as reproductive vessels carrying children. And one of the great lessons of the Millennium Development Goal process has been that that narrow, constricted vision of women is serving our planet very badly. We need to expand dramatically the scope and reach of our attention to women. And the Secretary General of the United Nations, Ban Ki-moon, in 2010, recognizing that failure, launched what he called his Every Woman, Every Child initiative, which sought to place women at the center of global development. Next week in New York, I and many other colleagues will be there to present new data on progress for women in the world and to celebrate, again, the opportunity to place women at the not just the center, but indeed at the top of our political concerns. The second reason why I was so enthusiastic about this conference was its focus on urban environments. Urban environments have been largely ignored during the past 15 years of the Millennium Development Goals. And working with colleagues at University College London, a commission chaired by Professor Yvonne Rydin, we were fortunate to be able to work with a wide range of individuals to think about how we shape cities for health. And this is incredibly important and comes just at the right moment, this particular meeting, because right now, people are gathering for next week's United Nations General Assembly to think about the post-2015 era, to think about where we go beyond the Millennium Development Goals. The single word that defines our future for the next 15 to 20 years is sustainability. And so the way we think of our urban environments, our urban landscapes, is absolutely critical in terms of sustainability. Sustainability is a very different concept from the concept that's ruled the past 15 years. Sustainability means thinking about the future and future generations as much as the present and present generations. Sustainability is about all of us, not just some of us. Sustainability means about thinking not just of a healthy population, but a healthy planet. The idea that we live within a safe operating space on this planet. The climate that surrounds us, the oceans around us, all of these forces, Earth systems, determine in an interactive way with our own species our possibilities for survival. And sustainability also means thinking differently about our economy. Right now, the great goal is maximum economic growth to get out of the recession that we have been in. But just think about that for a moment. If you are in a part of the planet where you have many, many millions of your population living in poverty, the right thing to do is to build power stations fueled by fossil fuels. That's the right thing to do in the present because it might well contribute to solving your poverty problems. But in the long term, it's the wrong thing to do because it will add to the global risks around climate change. So how do we rethink our models for economic growth? Because optimal economic growth is not going to be the way forward for the future. It is not going to be the same as sustainable economic growth. So the next 15 years is going to require a radical reappraisal of the way we think about our futures on this planet. And then if we link these two ideas of women and the urban environment, then we also discover remarkable new ideas. AFAF is co-chair of another commission that we're running on women and health. And one of the key findings of that commission is something we all know intuitively, but has not been widely accepted and embraced in policy circles, that women make a massive, but as yet unmeasured contribution to our economic and cultural life. And this commission is going to set out the economic case for why we need to take women more seriously. We are also publishing later this year a commission on investing in health, chaired by Larry Summers, and thank goodness he didn't get the job at the Federal Reserve, so that he can come to London on December the 3rd to actually launch that commission. And one of the key findings of that commission, again, is the centrality of women in the economy. Take Norway. Most people think Norway is rich because of its oil. Wrong. Norway is rich because women entered the labour market. And indeed, when you look at the history of nations, those nations where women have successfully entered the labour market are those nations that have had accelerated economic growth and accelerated improvements in health. The last reason why I was so keen to be involved in this conference was its focus on solutions, on innovation. We saw earlier that beautiful app for the mother and father going through a pregnancy together. When I think about the pregnancy that my wife and I went through together, my goodness, how different it was compared with what we saw there. I believe in natural childbirth, but my God, not in the United Kingdom, I don't. I can remember sitting with 6 other grown men on buckets, heaving and pretending to deliver a child as we pushed and pushed and pushed, sitting on these buckets in somebody's front room in Kentish Town. That's natural childbirth for men. And then, when my wife finally did go into labor in the middle of the night, I did what I was supposed to do. I got the transcutaneous nerve leads and I strapped them to her back and I turned the machine on as she was writhing in agony and pain on the bed. She ripped them off, said many expletives I couldn't possibly repeat to you, and we raced to the hospital. The hospital, fantastic. What a great place, a palace of science and innovation. Yes? Well, it was the Whittington Hospital, a lovely hospital. But we went there and the maternity unit doors were shut. We knocked on the door and a little man came out with a coffee cup in his hand and looked at us quizzically saying, "What do you want?" And we knocked on the door again and said, "My wife's in labor." And then he pointed us his coffee cup to say, "I'm on my tea break." Eventually we managed to penetrate the sanctum, the inner sanctum of the Whittington Hospital, and had a beautiful daughter. But my God, it was not an easy process to get there. And any kind of innovation, whether it's an app or other solution, I'm all for. It is a personal issue, though, this conference. And it's a personal issue for all of us as individuals and as parents. I have a 12-year-old daughter who's called Isabel, and I hope that the aspirations and visions that we're setting out at this conference can be met for her, as for your families too. A safe and healthy life, most likely in a city. But here is a group of people who, again, are pervasively neglected in our global and national discourse, and that is adolescents. Those young people aged between the ages of 10 and their early 20s. There are 1.2 billion adolescents on the planet today. In 2009, 50% of those adolescents lived in cities. By 2050, it will be 80% of adolescents who will live in cities. 16 million adolescents in the world every year deliver a baby under the age of 19. Children born to adolescents suffer greater morbidity and mortality than any other group in our population. The health hazards of tobacco and alcohol are increasing, are growing for our adolescent population. And adolescent health is improving at much slower rates than for any other group in our societies. So as we're thinking about the future of women, as we're thinking about the future of our urban environments in a post-2015 period defined by the idea of sustainability, please also think about our 1.2 billion adolescents on this planet. Their futures that depend upon our decisions at meetings like this. Thank you so much for being here, and thank you for bearing with me while I was a little late. Enjoy your lunch.